It's the leading cause of death for men and women in the United States. And we're talking heart disease. Here with us today, sponsoring our segment from Carle and how they're ready to help you with your heart health is Dr. Ken Bodine. Welcome, Dr. Bodine. It's good to have you here. And February is National Heart Health Month. Is that right?
Yes, and thank you for inviting me. It's a pleasure. Yes, every February is National Heart Month, and so it's very important for us to talk about coronary artery disease and the importance in the population. And as you mentioned, coronary disease is the leading cause of death for both men and women, and sometimes women don't realize that. They think it's breast cancer or some other female-related problem. But coronary disease is the most important problem for men and women.
And it's, I know probably most people watching, if they haven't had an issue themselves, know somebody who's had an issue. Is that prevalent? And so let's talk a little bit about the risk factors for heart disease. What are the things that cause these problems in the first place?
Yeah, risk factors are certainly the most important thing, and some of them we don't have any control on. Things like your age, your sex, your family history. We really can't do a lot about that. But there's a lot of things we can do things about. Things like your blood pressure, cholesterol numbers, diabetes. Are you overweight? Are you physically active? Do you smoke? Those are all things that we pay attention to when we're seeing patients.
And so trying to, obviously, if those things are present, the things that you can control, try to make some different decisions in order to give yourself a better chance.
That's right, and we certainly encourage everybody to check with their primary physician and know their numbers. What is their blood pressure? What is their cholesterol? What is their blood sugar
Set
number?
that baseline and understand where your body's at.
Right, and then it's very important to look at lifestyle. Whenever we start a treatment plan, lifestyle is the foundation of that, and that includes diet, exercise, stress management, not smoking. And when you get into diet, you know, the American Heart Association recommends what's called a Mediterranean diet, and that's a plant-based diet, but it's not completely vegetarian or vegan. It really emphasizes decreasing the saturated fats and cholesterol and increasing fruits, vegetables, lean meats, low-fat dairy products, fish, those sort of things.
So what you eat is actually a huge part of, because it's artery health at the end of the day. Am I understanding that correctly?
That's right.
It's the pipes, it's the blood flow that, and so the better foods you put into your body, the healthier that pipeline is going to be?
Correct. And also, in addition to just what you're eating, how much. We have a serious problem in this country with obesity. Over 50% of people are overweight or obese. And a lot of it has to do with portion size. And you can notice that when you go to a restaurant. The size of a portion over the last 20 years has increased dramatically. So we really need to cut down on how much we're eating. And then in combination with that, exercise is really a key thing. I've been a lifelong exerciser, so I'm very passionate about that. But the general recommendation is to try to get 30 minutes of exercise 5 days a week.
5 days a week, and that's something I've started incorporating in my life because I just turned 40. Now,
Excellent.
We're running out of time, but I want to make sure we talk about some of the symptoms and signs of a heart attack. So if you do find yourself in that position where you are having an episode or an event, what are we supposed to be looking for?
In general, the typical symptoms are pressure or discomfort in the center of your chest. It might radiate up to your neck, your jaw, down your left arm. Sometimes it's associated with nausea, vomiting possibly, getting very sweaty. Some people think it might just be heartburn and they ignore it. That can be a real problem.
It's confusing symptoms.
Correct.
Thinking that it's something else when it's actually something much more serious.
That's right, and if it persists, that's when we really recommend you get help. And we really don't want you driving to the hospital or the ER by yourself. It's really more important to call 911 and let them do their job.
So I was just going to ask that, like if you are having symptoms, what do? It sounds like you call 911.
Correct.
Okay. So, you know, that way the paramedics come, you're getting immediate attention, you're not having an episode driving in the car where you lose consciousness or something worse. So
exactly,
all of
because
these super important things
certainly do happen. And so we just want people to be cautious. It's okay if it ends up being a false alarm. We'd rather see that than have you have a serious event at home.
Absolutely. Well, Dr. Bodine, I appreciate you bringing this information to us. And as we are looking at heart health in February, it's good to have information. Information is powerful. So thanks so much for being with us today. For all of these heart health tips, and if you want to connect with Carle, who we very much appreciate sponsoring our segment this afternoon, you can find more information on our website at ciLiving.tv.